All set? Pallavi ji, all set? Shall we start?
Yes, ma'am. Please go
Yeah.
ahead. Thank you.
Am I audible, ma'am?
Yes. Yes, yes.
Yes, please.
Shall I start?
Yes, ma'am.
A very good afternoon to one and all present on this platform. I welcome all of you on behalf of Women Pediatrician Forum in today's session. As we all know, good mental health is important for preteens and teenage development, strong relationship and resilience. In spite of all the awareness campaigns, a lot of questions need to be answered. To get these answers to these problems, we have planned a legendary talk with Dr. Preeti Galgali ma'am on stress management in adolescent. Moderator of today's session will be Dr. Neelam Mohan ma'am. Pallavi ji, can you display the introductory slide of Dr. Neelam Mohan ma'am?
Yes, ma'am. Sharing the same.
Dr. Neelam Mohan ma'am, as we all know, is prestigious BC Roy awardee. She is Senior Director of Department of Pediatric Gastroenterology, Hepatology, and Liver Transplant Institute at Medanta Medicity, Gurugram. With this, I invite Dr. Neelam Mohan ma'am for moderating this session. Dr. Neelam.
Thank you so much. Thank you so much, Anuradha, for giving this opportunity. And I'm indebted to the Women Pediatric Forum and Dr. Sangeeta Lodha, who's been kind enough to allow me to chair this session because this topic is something very close to my heart. And I've been involved, thanks to Women Forum, in the parenting module too. So it is indeed my pleasure to introduce Dr. Preeti. And we all know when the topic today is stress management in adolescents. And when we talk about adolescence, we know that, yes, it is a transition between children to adults. But it is not only the biological changes that these, children or adults, whatever these adolescents are undergoing, but also a lot of psychosocial changes that they undergo. Shockingly, the world statistics says that 10 to 20% of the adolescents have mental health issues, and sadly, for a lot of them are underdiagnosed and undertreated. As a pediatric gastroenterologist, I see a lot of psychosomatic problems which are related to anxiety, depression, etc., presenting to me in various forms like pain abdomen, other reflux associated issues. But, dear friends, what is really shocking for you to learn is that the statistics in India has shown that 25% of the suicide in adolescent boys in India and 50 to 75%, deaths in adolescent girls in India. Both of them are secondary to suicide. It's a very important cause of adolescent deaths in India. And the survey in 2015 just said that we have 7% of these problems. Dear colleagues, it's just the tip of iceberg. And to speak on this, we have now Dr. Preeti Galgali. We would all welcome her on this podium. Please share the slide, the organizers. Preeti is an adolescent health specialist, head in the adolescent clinic in Manipal Hospital. Not only is she been blessed with giving 200 talks nationally and internationally and including orations, I would just say the best feather in her hat is that she was fortunate not only to be the chairperson of the Adolescent Health Academy in 2019, but also the national convener of the first adolescent guidelines that came in India in 2022. She's dedicated herself to spreading this knowledge, and definitely she was the right person chosen in the international forum to be the co-chair of the educational committee for the International Association of Adolescent Health. And I would not come between you and Preeti, and fortunate that the Women Pediatric Forum opened their this year's talk with one of the pioneers to give us talk on stress management in adolescence, whatever field you are, whether you're a pediatrician, whether you're a doctor, whether you're a mother, a parent, a colleague, a friend, this is the right topic to understand because all of you will see and meet adolescents. With that, I share the mic over to Preeti. Thank you.
Thank you very much, Dr. Neelam, for setting the context and emphasizing the importance of the topic today. I also thank Dr. Sangeeta and the Women Pediatrician Forum team for inviting me. And it's always a pleasure to be talking about adolescent health because this is what I love. And
while she's setting up Connect, I would say we have legends sitting here today enjoying this session. Asha Banappa, Dr. Madhu, who's been from Jaipur. The more I say, the less it is on them. I think Preeti is back with the slides. Over to you, Preeti.
Okay. Thank you, Dr. Neelam. I'm unfortunately having some problem with my Wi-Fi connection, so please feel free to kind of tell me if I keep on talking and you can't see the slides or you can't hear me. So, stress management for adolescents. In the next few minutes, we are going to talk about what is stress, adolescence and stress. Why are we so concerned about stress in the adolescent period? What is the neurobiology and science of stress? A few stress management strategies and clinical pearls and resources. And I would keep it more generic, this talk, so that it appeals to all parents, also adolescents themselves, and not particularly pediatricians. So please forgive me if I don't sound too academic in this talk. So what is stress? So stress is a challenge to our internal homeostasis. So an adolescent has a beautiful complexion and suddenly a pimple appears on the face. Well, that can cause stress. Adolescents and students go to school and colleges every day and suddenly there is an exam. Well, that is something different. It is not something which is routine and that can cause stress. We are used to studying in a very calm environment and suddenly there is a loudspeaker blaring. That can cause stress. The stress can be both physical and it can also be psychological. But how do we want our teens to be? We all want them to be happy from within, to have achieved optimum potential, to cope well with stress, work productively and fruitfully, and have healthy interpersonal relationships. So this is actually what we want our teens to have: good mental well-being. And recently, there was a new definition of adolescent well-being, which stated that adolescents must have the support, confidence, and resources to thrive in the context of secure and healthy relationships to realize their full potential and rights. In short, they should be stress-free. And what are the criteria for adolescent well-being? Good health, optimal nutrition, connectedness, positive values, contribution to society, safety and a supportive environment, learning, competence, education, skills, employability, agency, and resilience. By agency, we mean is confidence, and resilience you're well aware about. Now, doesn't this sound very familiar, or like the early childhood nurturing care development circle? Yes, it is taken from there. So again, to re-emphasize, it is not only the first 100 days of life that are important. It is, in fact, the first 10,000 days. That means 0 to 24 years, which are so very important for development. Rather about the rise in non-communicable diseases, and we know the prevention of non-communicable disease, the best time to intervene is in the mother. Next, the
Dr. Preeti, we can't hear you.
Yeah, Preeti, we need you to switch off your mobile, your photograph and just display the slides. So while Preeti is getting ready for sharing the slides, we would request all those who have questions to talk about it. And as Preeti was showing in her last slide, he said, someone can call Preeti, please. He said about nutrition, he said about uh, safe environment. Isn't it our responsibility while we talk about a safe and a supportive environment? We mean it should be both at home and outside. And we talk about nutrition.
Madam Dr.
Nutrition
Priti has joined. Madam Dr. Priti has joined. And Dr. Priti, will you please keep your video off and present the slide? I think it will help. Dr. Priti? Dr. Priti?
Okay, can you hear me
So
now?
while someone can call her, Preeti, are you there?
Can you hear me?
Yes,
Dr.
yes,
Neelam?
ma'am. Yeah.
Yeah, don't showcase your
Can you hear me?
photograph on the slide. You just show the slides and you can switch off the camera for you.
Preeti, stop the video, concentrate on the slides and audio.
Thank you.
Yeah,
Asha.
I just stopped my video. So can you see
Yes,
the slides?
good.
But can you see the slides?
Yes,
Yes,
ma'am.
we can see the slides.
We can see the slide.
I think it would be better to go on the mobile and someone can show. So, dear friends, we were talking about this slide when we are talking about good health and optimism, and we're talking about the nutrition. So, what is very important when we talk about mental health is for all you all to realize that even deficiencies in your nutrition can give rise to mental health issues. Simple things like B12 deficiency, iron deficiency, anemia, these all also deficiencies can give rise to issues which can be related to mental health issues. Therefore, it is very important that we look into the nutrition of a child and we not only concentrate on grains. Are you there, Preeti?
Can
But
you hear me?
we should.
Dr. Neelam?
Yes, we can see. I'm just pitching in when you're not there.
Dr. Priti, you go ahead.
I think somebody can call her and say to do the presentation from the mobile while Anuradha can display the slides. Is that okay, Sangeeta?
Yes, madam. Yes, madam.
So if someone can say that
Okay, can you
somebody
hear me,
else is
Sangeeta?
projecting the slides and she can just do it from a mobile.
Miss Pallavi, do you have presentation?
Hello? Yes, ma'am.
Do you have presentation?
No, ma'am, I don't have. You can
Okay.
send it to me in the group.
Okay, then Priti will only just send to you.
Okay,
You can
should I
send it to
speak
me.
something in the meantime? Is that okay with you, Sangeeta ji?
Ma'am, ask her to share the presentation.
Yes, ma'am. Yes, ma'am.
I can show it.
Yes, you can show and she can just join by phone. Somebody tell her to just join on the phone and we are going to
I'm
share the
calling. I'm
slides.
calling her.
Hello.
So while these people are there, thanks, Jaya. Jayashree thinks that I can share my perspective. Thank you. So what is very interesting is that all of us in our practice, we see that you should have an eye to identify. So when the patient comes, I mean, over the years, my psychologist feels that how is it that you identify? you have to look into the subtle things while the patient, say, example is talking about, say, pain or dyspepsia. Is there any correlation to the typical symptoms that you would see in them? Is there an eye-to-eye connect when the child or the adolescent is talking to you? Or is the adolescent very fidgety? And the adolescent, how is the voice? How are they speaking? Is she very quiet while the parents are talking about? Does she look from the corner of her eye towards her father or towards her mother? These are subtle things which I look into.
Hello, Dr. Neelam.
And they are.
Sorry
Yeah.
to interrupt you. Dr. Preeti Galagali can just play the slide also. Now she's ready to speak, I think. She just
Great.
called me.
Thank you.
So I request Dr.
Yes.
Preeti Galagali to take the lead. We can see your slides very well, madam. So you can go ahead.
Okay, can you hear me, Sangeeta?
Yes,
Yes,
madam.
darling.
Yes.
Okay. So I'm so sorry for this. This is adding on to my stress, and I have to take deep breaths to calm myself down.
Yes.
Anyway, so we know that stress can lead to non-communicable diseases, and the best time to interfere is in the pregnant mother, even before that, in the adolescent girl, even the adolescent boy who's going to become a father later, the infant, the child and adolescent period. And we know that physical inactivity, poor stress management, alcohol and tobacco use, unhealthy diet, unhealthy environment can lead to, am I audible?
You are very
Yes.
well audible.
Yes, ma'am. Very loud and clear. Please go ahead.
Okay. Can lead to non-communicable diseases later. And also, WHO has said that 70% of the premature adult mortality and morbidity are due to behavior and conditions that begin in adolescence. And as you can see from this, that poor stress management is actually the root cause, and we'll talk more about it. For pediatricians, it's important to know that 50% of the mental disorders present before 14 years of age. And yes, uncontrolled stress can lead to mental disorders. Hence, it's very important to pick them up, and stress management has a role in prevention. When talking about stress in India, 23% child marriage amongst adolescents and 59% of 15 to 19 years old are anemic, and this also adds to the stress. So you can see that stressors are very much dependent on regions, and we have to be aware of them to really give adequate stress management. Now, adolescence, it is known, is a unique opportunity for actually building health and well-being. And as already mentioned by Dr. Neelam, there are psychosocial changes, population events like mass events, war, disaster, climate change can have a big influence on the adolescent brain, and social connections actually help the adolescent brain to thrive. We also know that if we invest in adolescent health, it is healthy adolescents now, healthy adults for the future, and healthy future generations. Hence, all the more reason to understand that there is a triple benefit. Now, coming to teen stressors, how many teen stressors are there? Well, if you talk to teens, they will say 101, relationships, parents, college, keeping up, fitting in, expectations, school, overscheduling. And when you ask them, when do you feel stress? They would often say that there are only 2 times I feel stress. That is day and night. That is all the time. Now, what are the stressors? The stressors can be related to the individual. So, like we said, the pubertal changes itself could lead to stress, or there could be chronic disease like in the form of diabetes mellitus or asthma. Then the stress could be in the family. The family, there could be a father or a mother with an alcohol use disorder. In the friends bullying, negative peer pressure. Then in the school, especially with a child with a learning disability, the teacher not understanding the issue and being abusive, or too tough competition in the school, too much academic pressure. Media, we are well aware, when they try to have a body image, which fits into the celebrities, and what the media keeps on emphasizing can lead to eating disorder, body image issues, is just one of the iceberg. We also know about cyberbullying. We also know about the needs for likes pushing the child into depression. Community. How does the community respond to the adolescent population? Do they think that they are a fantastic resource, or do they think that they are a pain in the neck? So the community also has a big role in adding or decreasing to the stress. The community also, how is the pollution in the community? How is the environment, the built environment, which can either decrease stress or even add to the stress? So as I was saying before, these very components which are stressors could be stress busters. For a child with diabetes who follows the management regimen adequately could actually achieve his potential and more. A family which is supportive, especially those with neurodevelopmental disabilities, can work wonders with the child. In encouraging friends who build up self-esteem can be an asset, and so can be an encouraging school with high school connectedness and encouraging teachers. Media can be a big source of stress busting. The jokes on the media, the learning material on the media can be a huge, big stress buster. The advocacy groups, for example, like climate change, and to relate to people of the same interest, especially for the LGBTQ community, the media can be a great stress buster. And as I said before, community which considers adolescents as assets and goes all out to help adolescents in this important developmental stage can be a great stress buster. So there's always a balance between protective factors and risk factors. And we know that warm, supportive parenting, school connectedness, spirituality, stable environment, positive experiences are great stress busters. And the research shows that even if there are early life stressors, more of protective factors in the adolescent period can actually reduce the risk for psychopathology. So the adverse childhood experiences, which we are so familiar with, which is a source of chronic stress, if there are protective factors in the adolescent period, we can actually mitigate most of these stressors. We all know, and more so during the COVID, this was pushed in that we are not all in the same boat. We are all in the same storm. Some are on super yachts and some have just one oar. So you would understand that the stress response, our stress management techniques have to be very, very personalized depending on the situation. Just let me tell you with an example. You all know about Neeraj Chopra, and how did he actually start the javelin? It was rather for a stress buster, because he was being cyberbullied. He was not being cyberbullied, he was being bullied in person because he was of a higher weight. And his parents motivated him to take up javelin to actually lose weight. So here was a parent which acted as a stress. Had the support of her parents who motivated her to become an ace shooter. So you can understand that both these sports person actually require different stress management strategies, one with a disability, the other without a disability, to overcome their stress. Now, what does the neurobiology say? We all are familiar with the early man living in a cave, and if suddenly a lion was to come in front of him, his stress response would get activated. So what would happen? There would be more blood which is pushed into his muscles and more blood being pushed into the brain so that he can think faster and he can run faster. And the less blood goes into his digestive system and the kidneys. And that is responsible for sometimes the butterflies that we have in our stomach when we are under stress. So again, coming back to the early man to understand the stress response, there is also dilatation of the pupils. There is also the fast beating of the heart. There is fast respiration to get more oxygen. And this is because of the release of, as we all know, adrenaline from the sympathetic nervous system and also from the adrenal gland. We also know that there is a release of steroid hormone that helps cortisol, helps in glycogenolysis. It also triggers the T lymphocytes into action. And in fact, little bit of stress, in fact, improves our immunity. So what happens to the early man when he gets a trigger with the stress response? He runs fast, though we classically know about the fight, flight, and freeze reaction. If the early man was to fight the lion or was to freeze, he would get eaten off. So what he does is he tries to run away using the stress response. So he runs fast, he hides behind a bush, and then the lion goes away. And when the lion goes away, all the stress settles down, all the hormones come down to their base level, and everything is fine. But in real life, we really don't have these lions. We have paper lions in the form of exams, in the form of questions that are asked by our teachers, in the form of relationships which we want to be fitting in. And these are paper tigers or paper lions which simply won't go away. So are they a source of chronic stress? Of course not. They may not be a source of stress if you know how to manage stress properly. Hence, we need to get our parasympathetic or relaxation system into action if we are going to counter these sources of stress. So a little bit of stress, we all are very, very much familiar. Before the exams, we are able to focus better and learn better in a short duration. And this is called the good stress or the eustress. We also know about the pandemic. In the pandemic, many of us tapped on our potentials of which we had actually forgotten about, maybe drawing, maybe singing, to fight over our stress. And this was good stress. It helped us to optimize our performance. But only when the stress becomes too much and we are not able to handle it, do we start getting the tremors, do we start sometimes collapsing, getting fainting during exams, sometimes getting a panic attack. And this is the one which is called distress. And this does not allow us to function optimally. So it's important for us to understand that stress will always exist. There will always be new challenges in life, but we want to put our body into a parasympathetic response or into a minimal sympathetic response that helps us to counter these challenges. We should also be familiar with the mental health continuum. As pediatricians, as even as the general public, we should know that the continuum varies from healthy, mild mental distress, moderate mental health problem, and severe mental health problem. So how do we really know that? When there is no distress, of course, there will be normal functioning. Most of us function in the mild distress range, which is common and which is reversible. So just like the early man, we have the stress, we fight the stress, and then we are calm and we are okay. The one we have to guide against is moderate and severe stress in which there is functional impairment. For an adolescent, this severe amount of stress will not allow the adolescent to study well, attend college, talk to people, look after his daily functions of eating, sleeping, and maybe even hygiene. And this is what we need to guard against. And as pediatricians, we need to be aware about this mental health continuum. Why are we focusing on adolescents? Why is it so important to teach them stress management techniques? This is because we must be familiar with the development of the brain. Now, as puberty sets in, the first center to mature is actually the limbic system or the center of emotions. So this means the adolescent is high on emotions. The adolescent responds to a stressful situation in a very emotional way, might get very angry or might get very withdrawn. Also, the reward center matures. So the adolescent actually is looking for quick fix solutions because they want their reward center, which has high dopaminergic neurons, to be always happy. So stress is one which can actually counter that sensation of rewards. So they look for quick fixes in the form of drugs, in the form of excess media use, sometimes even in the form of excess eating to counter stress. So what do we need to do as physicians, as caregivers for the adolescents, and adolescents themselves should understand to mitigate stress, maybe look for healthy alternatives. It could be exercise, it could be indulging in dance, it could be singing if you like it, and that could be powerful stress busters, and not to give in to unhealthy stress busters. This is more so important for the adolescents because the prefrontal cortex, the executive center of the brain, which actually helps in controlling emotions and rewards behavior, only matures in the late 20s. Not only this, we should also understand that the adolescent brain is under development. So the neuronal connections which fire together in adolescence get hardwired in adulthood. So the stress management techniques which are taught in the adolescent, actually the adolescent tends to use these techniques even in adulthood. The brain, this is one of the developmental periods in the brain, is very, very plastic next to the first 3 years of life. Hence, early, what we say, ECD is important, but so is adolescent development because it is so very close to adulthood. We should also understand that the hypothalamic pituitary adrenal axis fires more in the adolescent period. So there are surges of cortisol hormone and surges of adrenaline when the stress response is triggered much more than what it occurs in adults. Hence, all adolescents, as a rule, should be taught adequate stress management techniques. Now, this is another picture of the brain which shows the functional MRI images, and blue area showing myelination or thereby maturity of the brains. It is easier for you to understand here that it is only in the late 20s that there is more blue areas and that the myelination of brain is complete. Hence, the need for teaching stress management techniques by non-judgmental, trustworthy, knowledgeable adults who have a good connect with the adolescent is so very important in this period. Now, when there is mental distress, what can happen? As Dr. Neelam already said, there can be stomach pains, there can be headache, there can be sweating, pimples, sleep disturbances. There can be psychological distress signs, poor focus, forgetfulness, loss of interest in activities, too much of crying, sadness, withdrawal, poor appetite, suicidal thoughts. The behavior can be excessive irritability, disturbed family relationships and friends, and self-harm. So if you remember the continuum, you can see that distress is towards the other side of the continuum, almost going on into a mental disorder. And adolescents, as I told you before, they're emotional, they seek rewards, though, so they look for quick fixes. If they have too much of stress, they want to be lost in the virtual environment. We often grumble about they using too much of the digital devices. Have we ever gone into asking them why are they use the devices? And to your surprise, you will know that when you assess the adolescent, there will be an underlying ADHD, depression, anxiety, which has not been explored, or severe mental distress, which the adolescent is undergoing, and teaching them stress management techniques, in fact, helps them to overcome their preoccupation with the digital devices. Of course, as I said before, they can sometimes withdraw totally. Some of them, because of stress and especially academic failure, tend to run away from home. In India, the most common causes of stress in the Indian adolescent are family conflicts, family problems, and also academic stress, apart from relationship issues, mental disorders, and even chronic medical disorders. The wrong ways of handling stress could also culminate in anger, shouting, violence, drug use, self-harm, and even suicide. And this is what we don't want the adolescent to do. So we need to give each adolescent a personalized stress management plan. For example, if you tell the adolescent, hey, when you're feeling stressed, please sing. An adolescent hates singing. So your stress management plan is not going to work. And if the adolescent says, I can't sing, doctor, but I love to dance. So that is the tool which you have to put in their toolkit. So remember, each adolescent needs a personalized stress management plan, though you can have a general outline for this plan. And it is never too late to build your toolkit. In fact, this toolkit should be built from infancy and childhood onwards, when there is attachment pattern which is built up, when there are social relationships being built up. From right there, the stress management plan starts. But if you're planning to do it in the adolescent period, I would suggest you to follow these 4 main broad headings: healthy lifestyle, nutrition, sleep, exercise, study skills. Very important. Like I said, academic stress is a lot in the Indian adolescent. Active relaxation techniques. It could be hobbies, or it could be yoga, it could be meditation, right from childhood onwards. Nurture interpersonal relationship. Talk about your strengths. Very, very important. But also think about your weaknesses, opportunity, and threats which are there, which would actually prevent your weaknesses from becoming strengths. So we call this the SWOT analysis. Look at your strengths, look at your weaknesses, look at the opportunities that are available to strengthen your strengths and overcome your weaknesses, and look at threats that do not allow you to do so. So the threats can be in the form of friends who are negative, or the threats can be in the form of media, which takes you away from things which you really like. So it is again very, very individualized. So that is point number 1. The second is dealing with emotions. And the third one, tackling the problem. So dealing with emotions, what do we mean by that? We say, how do you develop your emotional intelligence? That dealing with emotions could be to take instant vacations. So something is getting too overwhelming. You can always say, hey, I think I need to drink some water. So from a very intensely emotional situation, you take a break, take a deep breath, think what you need to speak, and then come back. Releasing emotional tension, exercise is one of the things which we say, which helps you to use up your adrenaline and cortisol. And also talking with the other people is a fantastic way of dealing with emotions. Tackling the problem, solve the problem. And I'll be talking a little bit about this. Avoid stressors. So there are friends who add to your stress. Find a new bunch of friends. That's important. So you feel very irritable when you go into a polluted area. Do not go to that area. Look for some other place where you could go. Let some things go. So you have to go to this polluted area or the market. You do not grumble about it, but think, how could you overcome the pollution? Maybe wear a mask. That may make things better. So tackling the problem is equally important as dealing with emotions. And contributing to the family, society, and community. Understanding that other people also have stressors, and when you help them, it is a big stress busters. So if you can make a personalized stress management plan for your adolescent, collaborate with the adolescent, give them choices. Please understand, adolescents like autonomy. So you don't have to tell them what to do. You just have to give them the choices, give them the toolkit, and let them choose what suits them the best. Healthy lifestyles, dealing with emotion, tackling the problem, and contributing would be the main 4 headings. Again, going through this in a little bit of depth, I've already talked about healthy eating, exercise, getting at least 8 to 9 hours of sleep. Praying is a very powerful stress buster. And again, it has been proved that spirituality is excellent to overcome stress. Yoga, meditation, study skills, effective time management, indulging in hobbies, healthy media balance, and not only a media balance, but also using ergonomics. The correct way of using media is also important to beat the stress. Involving yourself in art, especially mandala art, And this is art by one of my patients who was feeling intense anxiety during COVID-19. He used to share with me one mandala art at least once every day for a month. And these are some of the beautiful figures which he drew, which help him to overcome the corona anxiety. Connecting with the nature, it helps in grounding. It is an extremely great stress buster. So I think that's important. And also understanding, learning from the nature. It is very nice for all adolescents to actually build up this narrative therapy, which we call building a tree of life. So there are branches, which are your hopes, dreams, and wishes. This is your ground, your relatives, your grounding, the leaves, the important people in my life, and how as a strong tree, I can bend, but I will not break when there are storms and challenges. And all this has to be done before, not when there is a stressful situation. Because if it is done before, it builds up the self-esteem. But even when there is a stressful situation and when the adolescent is calm, then definitely you can help him in building this tree for life. Talking to other people, sharing your concerns with other adults and with well-meaning friends can be an extremely important stress buster. And social connections, in fact, as the age proceeds, are the most important stress busters. And all adolescents should learn interpersonal skills and effective communication strategies. Again, when the adolescent is in a good frame of mind, writing positive affirmation cards, I can make a difference. I believe in myself. Keeping a happiness jar. We often forget what good has happened to us, and we have this habit of actually accumulating all the bad that has happened. Today, my teacher praised me. Okay, we often forget that when the teacher scolds us. So it is important that we catch those happy moments and put them in a jar. And when we are feeling down, we open that jar and see, when did my teacher praise me? When did my father give me a hug? When did my mother take me out to the park? These are some happy moments to be captured and kept in the happiness jar. Journaling, writing a diary is also an excellent way of beating the stress. Reading someone else's diary, reading someone else's stories on how they overcame challenges could also be effective stress busters. Now we have talked about these and which come under healthy lifestyle, but suppose there's a panic situation. What helps us to overcome that stress quickly? So I go for an exam and suddenly I start breathing very heavily. What can I do to ground myself and not to think about the future that I might fail, or think about the past that I have failed before? So what you can do is you can do this 5, 4, 3, 2, 1. Tap on your senses. 5 things that you can see around. It could be a laptop, it could be a table, it could be a chair, it could be a fan, it could be a window. 4 things that you can touch. Similarly, you can touch 4 things. 3 things that you can hear: your own voice, the voice of the teacher, the voice of the chirping birds outside. Acknowledge 2 things that you can smell. It could be your own hand, it could be your rubber, or it could be your pen. 1 thing that you can taste, it could be just your saliva. The moment you do this, you ground yourself, you are distracted from the thing that is causing you panic. It helps you to cool down and plan ahead. Another powerful way, which is much in use today, is the physiological sigh. You know how we sigh when we get tired or when we feel the thing, oh my God, this is too tough, we sigh. What they are saying is this sigh helps to trigger the parasympathetic relaxation state. So what do? You take 1 long inhale, then you take a second long inhale, a short inhale, and then you take a long exhale. So I hope you can hear me. Now, when you do this, what is going to happen? What is happening is the carbon dioxide, which is accumulated, which is causing the panic attack, would kind of come out. The other thing what is going to happen is that your heart rate is going to come down when you do a long exhalation because you stimulate the parasympathetic state. Another thing which can overcome panic attack is square breathing. Breathe in for 4 seconds. 1, 2, 3, 4. Hold your breath for 4 seconds. Exhale for 4 seconds and again hold your breath. So when you distract yourself from the thing which is causing you great emotional reactivity, focus on your breath. One is you take your attention away. Second, you stimulate your parasympathetic nervous system and it helps you to calm down. So this is an excellent way in acute stress situations to calm down. And once you have calmed down, what matters most is how you see yourself. So you can see this cat thinks it's a lion. So we have to develop a strong self-esteem and always remember that there's a connection between thoughts, feelings, behavior. Now there's an exam and I feel, oh no, I can't do this. This is so much stressful. And when I challenge or change this thought and say, well, I have been studying well throughout the year. This is an opportunity to celebrate my learning. How do you feel then? You feel very positive towards the exam and you study better. But if you think exam is the worst thing that has happened in your life, you're going to feel very negative and you won't even feel like picking up your books. Again, the key is that you should have been studying throughout the year and not doing last minute studies. How does Neeraj Chopra fight his stress? You know, when he goes for an Olympic game, he thinks to himself, I have been practicing pretty hard and I am going to do my best with a feeling of optimism. So the same situation can make you cry, but if you change your perception, it can actually make you smile and laugh. We often talk about this, things you cannot control and things you can control, and focus on the things that you can control. Now, when I have been speaking about all this, you must be wondering, do adolescents need special techniques? I must share with you that a lot of research is now going on that the things which we use for adults actually may not work for adolescents. Remember, adolescents do not have a mature prefrontal cortex. They function from their limbic system. So if you tell them that you cannot control this, this can put them into more stress. So you have to tell them, even though you cannot control this, how can you make things better? So something like the hot weather. Okay, the weather is not in your control. The hot temperature is not in your control, but sitting under a fan, sitting in front of a cooler, drinking a cold water is definitely under your control. So the focus is on things which you can control. You tell the adolescent, oh, you are scared for a dog. Now start looking at a dog, imagining a dog, and start using your stress response. This will not work. Start using relaxation techniques. This will not work because this functions from the prefrontal cortex. You see a dog, you call me up and I'll come to help you. So remember, adolescents are more action-oriented rather than more going by the prefrontal cortex. And of course, use humor. I must thank Dr. Asha Venkappat today for putting this. So when you are under intense emotional reaction, keep a special file. You can tell the adolescent on their phone, which makes them laugh, which makes them smile. Humor is a fantastic stress buster. And when the adolescent, as I said, is in a moment of action. Sometimes when they are very much under stress, they may say things which they do not mean. So it's very important to teach them about their emotions, how to regulate their emotions, how to be empathetic, and how to build social skills. So your father comes back from work and he screams at you, can you just take a breath? And after your father has had his coffee, ask him, how was your day? Instead of just banging the door because your father screamed at you. So important to tell the adolescent to push the pause button, and so that they can actually get better with controlling their emotions. After they have controlled their emotions, is the time to teach them problem solving. And the Thirsty Crow is a fantastic example of problem solving. So take a deep breath, think you're important, analyze the causes, generate solutions, analyze pros and cons of each solution, choose the best solution, make a decision, and solve your problem happily. And that's exactly what the Thirsty Crow did. So that is what you have to teach the adolescent about problem solving, maintaining a gratitude journal, helping others in need, being environmental friendly, probably not only planting trees, but also doing action to be environmental friendly, not using a motorized vehicle, using a cycle. All this actually develop the collective resilience, and which is a great stress buster for the adolescent, because most of the adolescents are idealistic and they want to do well for the society. So as a doctor and as a parent, as an adolescent, we would insist on annual wellness visits where we look for these red flag signs of mental distress, significant fall in academic performance, change in behavior for more than 2 weeks. An adolescent who's very happy-go-lucky suddenly becomes very angry. Loss of interest in activities of friends for more than 2 weeks. An adolescent who always wanted to play with his friends suddenly says, I don't want to play with my friends. I want to stay locked inside my room. Persistent low mood for more than 2 weeks, loss of sleep, loss of appetite or more appetite, not being hygienic, recurrent pains and aches mean red flag signs of mental distress and need help. Now, these are the other signs which I put in red. Here, the parent or the physician has to act immediately. Drug use, violence, sexual abuse, cyberbullying, compulsive, uncontrolled, excessive media use, suicidal behavior, poor response to counseling, and if the person has been going for counseling for more than 6 weeks. To share in the end a few clinical pearls of stress management, I would request all physicians, first manage thy stress. Please take care of yourself. Of course, manage the medical and the neurodevelopmental disorders of patients under your care. Use head psychosocial history taking, talk about strengths, look at the mental health continuum, use scales to analyze stress objectively, prepare a personalized dynamic stress management plan, not only for adolescents, but also for caregivers. Follow motivational interviewing, strengths-based counseling, trauma-informed approach, cognitive behavior therapy, dialectical behavior therapy, interpersonal therapy as the case may require, and pharmacotherapy. Anticipatory guidance. If there's one anticipatory guidance, if you have to give out of all, it has to be stress management, because so many things are linked to it. Always remember, partnerships and collaborations is the way to go in adolescent medicine, and also for stress management. Partner with teachers, peers, nurses, parents, mental health professionals, other health professionals, social workers, community health workers, police, and lawyers. Keep this slide handy, because as I said, adolescents want action, and adolescents may not come to you. They want some resources which are very, very legitimate resources, helpful resources, which they can access on their own because they like autonomy and independence. So 112, 1098, National Toll-Free De-Addiction Helpline, Cybercrime to report 1930, Digital Detox Helpline, and Telemanas. These are good numbers to keep handy and to share with the adolescents. Also share some resources. The World Health Organization has this beautiful guide. But again, let me tell you, making room for stress is not what is going to work with the adolescents. Yes, definitely grounding, unhooking, being kind, engaging is what is going to work for the adolescents. Be very familiar with the life skills manual. And this is one of the life skills manual, which I really love. And it is available at nimhanschildprotect.in. These are fantastic life skills manual, and this gives a very comprehensive stress management plan. We would want all adolescents to walk on the path of health and well-being. And yes, definitely, this is my summary slide. We want the adolescents to connect with people around you, be active, keep your mind and body active, be aware, take notice of the world around you, keep learning, and help others. We don't want to remove the obstacles in the adolescent's path. We just want that the obstacles, in fact, go in such a way that they become the path and the adolescent becomes extremely resilient. In the end, you'll all agree with me, you only live once, but if you do it right, once is enough. Thank you very much. And once again, please excuse me for all the Wi-Fi stresses that I gave you. I'm so sorry for that.
No, rather you should be thankful for that, because you taught us how to practically do stress. And actually, many were wondering on the forum whether that was a part of the talk, that you had to do that to see how we will all react. And then they had planted me as a stress buster to tackle it and to get away from that. But anyway, a huge applause. Everybody can unmute themselves just so that Preeti can hear our applause. All of you, please unmute and give a big applause to Preeti. Thank you, Preeti. Thank you, thank you, thank you. That was truly wonderful. And I was supposed to take the questions, but I guess you are so wonderful the way you said it. There are 2 times when you don't get questions. Either you're not good or you're excellent. I think you took the other one, you're excellent. So there was not much to ask because you beautifully highlighted all the points in it. And Dr. Sangeeta, are there any more questions in that? Because to the
I
best
think
of
only
my
one
knowledge,
question is there, Doctor. I have shared in your chat box, madam.
okay.
How to release from the
So-
stress buster from during exam time. This is the question has been asked by someone. How to release the stress during exams period. That is the question.
Okay,
I
so
will-
I
yeah.
specifically did not go too much, but if you notice, I was covering it all the time. So
Yes.
it starts from actually a healthy lifestyle and regular study skills, and also looking for what are the problems what are the academic challenges? Are we missing out on an ADHD, a learning disability? I think that's extremely important, or a chronic medical disorder or a mental disorder. Once we have ruled those out and we can help the adolescent accordingly, we need to develop good study skills. And I think that requires, again, a little bit of time with the adolescent, understanding what are the challenges which the adolescent has in following study skills.
If I may be allowed to say, I think, as you rightly said, and you had spoken about it earlier, there are 2 things I would like to talk to the parents here. While we are talking about, please understand that my, brain is a part of your body. Health is, body and mind. So while you're talking about this stress, and it is extremely important to do what Preeti had highlighted. So whoever has asked the question, ensure that you're eating a very balanced diet. When we say balanced diet, your vegetable, fruits, legumes, and nuts, seed, milk. So it should be a balanced diet, which are ensuring that you're not eating an unhealthy, too much of sweets, oil, fat, stressors. These are supposed to be the unhealthy, which will not be good. So number 1. Number 2, regular timing of eating, so that when you get into too much of, like if you take long time fasting, your body is going to get into that negative energy mode. So regular eating is very important. Your sleep time is very important. And as Preeti said, exercise, even while you're studying, walking around while doing that is going to make a lot of difference. And some people like to take out the stress by talking. So the message also goes, if you are an adolescent and you're not able to identify whom you can connect, then you can shout out for help, or sometimes look for a family member or a friend who's there to talk. And speaking 20-30 minutes on phone to the best person whom you think is also a stressor with that. And can I invite Neetu now to be on the forum and ask any further questions?
I'll
Yes,
just
ma'am.
quickly
If any-
add to it. Neither, just a minute. You can do certain techniques like before the exam, do a good time management. How many chapters to read? How much time do you have? Make all your things ready for the next day. That is your pencils, your pad, your pens, everything ready. Ensure that you have good sleep the best day. The next day when you go for the exam, don't go very early and avoid friends who build up your stress. In fact, keep telling yourself, I've studied well, I'm going to do well. When you get the exam paper, again, utilize your time well. Suppose 5 mains, 60 minutes, give 10 minutes for each main, keep the last 10 minutes for revision. When you get stuck on something, we say jog your memory, do some quick relaxation exercises, like what I said, the breathing exercises. And after the exam, please remember no postmortems because you have an exam the next day. Think about the next day's exam. Of course, if you don't have an exam the next day, think and say what mistakes you have done and how to do it better the next time. I hope this is helpful because actually we have a full session on study skills and how to handle particularly exam stress.
Okay.
And we'll invite you that just before the exam.
Thank you.
Over to Neetu and Sangeeta.
Yeah, yeah.
Yes, ma'am.
Dr.
Actually, I think
Elizabeth, can
there
you
was one.
ask the question?
I think there was one
Hi.
more question, ma'am.
Yeah. Dr.
It
Elizabeth,
was-
yes, just
Yes,
another question.
Elizabeth ma'am has asked one question that there is a 13-year-old girl and she is having, her mother is a beautician and father, she is having a stepfather and she is not happy and she is always going by a public transport and she has multiple marks on her wrist and she want to be with her smart friend who is a girl. And how will we approach this case?
Madam, this would require, like I said, a one-on-one session with the child because we need to do a detailed psychosocial assessment. So the first thing which is worrying about this child is, I think, safety, the marks on the wrist. Where are the marks? Are they self-inflicted marks or is somebody abusing her? So that is the first thing which we want to ensure that the child is safe. So that is the biggest thing which is of concern in this child. And then further going on to assess her friendship with the girl. What purpose is this friendship serving? Is it a stress buster? Or are there any romantic affiliations to that? So again, this is a tricky question to answer on a forum like that, this without talking to the child. But I think the first thing is to ensure safety. Safety takes the lead here.
Thank you, ma'am. Are there any more questions?
I think Dr. Elizabeth Madam has asked this question that you have taken. Anyone else?
Ma'am, may I?
Yeah.
Yeah, this is Dr. Bhide from Nashik. Madam, I wanted to ask how to inculcate spirituality in children because I know what meditation means, how powerful it can be, but how to put it in the children, how to kind of make them start doing meditation and start their journey with spirituality to start with.
Shweta, it really depends on what do you mean by spirituality. Spirituality, to my understanding and from a little bit what I have read, is having a goal in life, pursuing that goal with the sense that you don't harm yourself and you don't harm others. So that's very important, I think that is a kind of spirituality. You first want the child to understand not to harm, to take care of themselves and not to harm other people whom they come in contact with and do things for the overall good of humanity. So this is what actually spirituality means to me. And I think this is not difficult to tell the adolescent because adolescents themselves actually want to contribute a lot, want to feel important, right? And this helps them to actually build up their self-esteem. Now, coming to the second part, meditation. Like I told you again, that adolescents are more working on their limbic system. So meditation may not appeal to them totally. But again, all adolescents are different. So what I do in my clinical practice is I have a website which I can share with you. It is a very, by a very famous mindfulness practitioner who's also an adolescent health specialist. This website is called Mindfulness for Teens.
Okay.
Mindfulness for Teens. And this is by Dr. Zhang Wo. And
Okay.
he's a Canadian adolescent health specialist. It has some guided meditations, which are for 3 minutes, 5 minutes, 10 minutes. So what I do in my clinic is I have an earphone. One end of the earphone I give to the adolescent. One I put it in my ear and I say, let's do it together and tell me how you feel about it. Okay. So this is one of the things which you can do. Do it with them and tell them. So one of the adolescents said, oh, I feel so relaxed. I'll do it every day, doctor. The another one said, I feel so bored. This is so boring. This is not my style. So it's okay. I think it's okay. You keep the options open. The second thing which I do is yoga for children 5 to 10 years and 10 to 15 years. Dr. Hemant Bhargav from Nimhans. You can access Dr. Hemant Bhargav YouTube channel, and it has videos. So what I give to the adolescents and the parents is, try this, see whether you like it or not. Now, when you look at the videos, 5 to 10 years and 10 to 15 years, it has a lot of activities. So Dr. Hemant Bhargav understands that. In fact, he was very, he was not at all happy doing I asked him to put these yoga videos during the COVID pandemic because I was getting a lot of patients with anxiety. And he said adolescents like movement. They are not going to be sitting calmly in a place. So if you see these yoga asanas which are there, they are made in a very joyful and with a lot of movement with a little bit of meditation. So I encourage you to try it out with your patients. Most of my patients have really enjoyed it. Right? And so beautifully, somebody has written here, Dr. Nagmani has written, it is a way of life. Spirituality, not just meditation. I 100% agree with that. Like I said before, what spirituality means to you is important. Meditation is great for the limbic system. Just saying Om, Om. More you prolong, it has been shown by research that it calms down the limbic system. So simple things, simple chanting. Right? We need not be very religious about it, because sometimes adolescents are very, kind of into that zone, the religion not important. We don't want to kind of get into an argument, though we would love it if they're religious and they follow the religious practices at home. So these are some of the stuff which you can do. Do it with them, encourage them, offer them as a choice. Don't force it down their throat. It really works sometimes and works well.
Yeah, thank you, ma'am. Ma'am, could you share the mindfulness for teens, that meditation you're talking about?
So you go to the website, Mindfulness for Teens, and there in the menu option, there are guided meditations.
Okay.
And then you can download those guided meditations onto your phone or onto your laptop.
Thank you so much, ma'am. Absolutely full of gratitude. Thank you so much.
You're most welcome, Dr. Shweta.
Thank you, ma'am. I think there are no more questions. Or are there any questions?
No, I think it's over. So we can go for vote.
Thank you so much, Dr. Preeti. As a moderator, it was indeed a pleasure to have you on board. And we would look forward for the Women Pediatric Forum to give opportunities more and more to all of us who had decades of experience. It's not all about theory, but so many things that we understand which time teaches you. And that's what is when we get those mature speakers. And we could see today's talk that we heard people talking about mental health and all on adolescent chapter, but the difference, it's the tuning. Somebody goes and plays the the radio, but somebody goes and fine tunes it and you start hearing it. So the end by she said gratitude, that meant a lot. We all need to express gratitude every day for all we've got. And thank you, Women's Pediatric Forum, Sangeeta, Madhuji, and everybody, Sangeeta and all, for giving this to me.
Thank you, madam.
If you just permit me, I would rather end in an academic note telling you that we have an Indianized version of the adolescent stress scale. That's one. Longitudinal studies are going on adolescent stress in India. There's a Sravana study going on in Mysore. There is the C Veda study going on in NIMHANS. So those of you who are looking for adolescent stress and what is it going to be having a longitudinal into the adult life, this is what you need to follow up. So maybe another time we could have a more academic discussion on adolescent stress in India.
Sure, ma'am.
Absolutely.
And now I request Dr. Neetu Beniwal to just give vote of thanks. And before that, I just want to make an announcement that this Tell series will go on every 4th Friday of the month. Next time, we are coming up with Dr. Sangeeta Yadav ma'am's talk on menstrual health and precocious puberty. So be with us and over to Dr. Neetu Beniwal for vote of thanks. And thanks a lot to Dr. Preeti Galagali to accept our invitation on behalf of WPF to just give this mind buster, stress buster talk on mental health issues in adolescents. Thank you. Over to Dr. Neetu.
Thank you, ma'am. On behalf of Women Pediatricians Forum, I express my sincere gratitude for hosting this informative webinar on adolescent mental health. I think the topic is incredibly relevant to all of us, and the discussion was insightful and engaging. And I particularly thank and appreciate Ma'am Preeti Galagali for sharing her expertise and valuable insights on this very critical topic. And also, I thank Madam Neelam Mohan for beautifully moderating this session and also sharing her experiences in between. I think the session equipped everyone with a better understanding of mental health issues in adolescents. And I believe this webinar will be immensely helpful for not only us pediatricians, but also for parents, educators, and anyone else who interacts with adolescents. And thank you, Women Pediatrician Forum, for providing a platform to address this crucial issue and equipping us with the knowledge and resources to support the mental well-being of young generations. And lastly, a big thanks to a woman behind this program, Ma'am Sangeeta Lodha, who is working hard day in and day out to make these programs successful. 3 cheers for ma'am. And I'm also thankful to all the participants who were patiently listening this program throughout the time. And I'm happy that we reached 75 mark of attendees, including our senior pediatricians like Elizabeth ma'am, Ma'am Madhu, Raturi, Asa Benkappa ma'am, and many more. I'm thankful to all of us.
Thank
Have a